I want to thank everybody for coming out on this beautiful afternoon. California Endowment is really proud to be able to support events like this and organizations that you'll hear from in a minute who are trying to improve access to health care. We believe that every person in City Heights, every person in California should have access to affordable quality health care. And we know that language and cultural appropriateness of services is a big issue. So I want to thank the women here for their leadership and look forward to hearing from them on plans to improve that access. Thank you. And them on plans to improve that access. Thank you.
I know that we're having a good time here today, but we're here about some very, very serious business. We're here about getting access to health care and hearing the stories and hearing how difficult it is for some members of our community to get access to health care. About a year ago, a group of women from City Heights Hope and from Umoja got together and decided that they needed to document the struggles that those communities are having getting health care. And they went out and they interviewed over 200 East African women about access to health care for their families. A number of the women who did this study are out there in the audience. So those of you who took part in this study, can you raise your hands? I know a number of them are serving food and there's folks around. So there's some folks there. This was a very powerful effort, and these women went out on their own interviewing again over 200 East African women, and they found out some very important things. One, they found out that 80% of the women they spoke to understood little or no English. Even though most of them spoke more than one language, they didn't understand English. We found out that when they went to the doctors, that very few of them ever got clear interpretation. So we also found that when they went to the doctors, not only could they not understand what the doctor was saying to them, or the doctor understand them, that almost none of them were able to get any material in their own language. And the result of that, obviously, was that their health care was not what it should be. And I have a panel here of women I'm going to introduce who are going to tell you their stories. But the most important thing we found in this research is the stories that you will hear in just a few seconds. These are the normal situation. They are not the exception. The person in this community who goes to the doctor, gets quality interpretation, and has a good visit is the exception. And that's part of what we're going to change. So to my right here, I have Zulaika. I have Leila Ali, Sarah Noor, and Aisha. And I'm going to hand the mic over to Leila Ali, who is going to tell you some of the struggles that she has faced trying to get health care for herself and for her children.
Welcome guys, and she's telling you about her own story. She said she took her kids to the doctor, and then the doctor ordered, because the doctor ordered wrong medicine for wrong dollars. It's gonna continue. She's a member of City High Hope. When she go there, she heard the research. She's not the only one woman has a problem. There's a 90% of women has the same problem like her. So that she said, because of the language, we are not sure, our medical. So we're not standing behind the medical between us and then our health. So we have to ask the government to be put it to our insurance, the quality interpreter. Healthy is very important for our lives. You can't walk, you can't do anything if you don't have it healthy. So that's why she said we need our interpreter for our medical things. She said we need our interpreter for our healthy. Everybody needed that. And thank you for you guys coming here.
Assalamu alaikum. She's greeting you guys with the Muslim greeting, which is Salaam Alaikum, and I greet you guys the same. Sahara here shares the story of her experience with working with this community in terms of medical stuff, and she finds that one of the biggest issues for many of the immigrants who are new to this country is that interpretation. Even though some of them might speak the language, however, they don't really know the terminology that the doctors use in the hospitals. Therefore, interpretation is very much needed. He says that most of the people that she met, they go to the hospitals, they get the wrong medication. They really don't know what language to use to tell the doctors, what they're experiencing. Therefore, the doctor gives them wrong medication, and they don't really take the medication. They take it home. They don't tell the doctor they're not going to take it. They just take it home, and they really throw it away. And they do that because they've seen a lot of people who have gotten wrong medications and have been affected by it. So therefore, that's the reason why they throw it away. She also states that many of those people who get those wrong medications end up not going to the hospitals when they really need to, but rather they stay home and they have like their natural cultural treatments that they use, herbs and stuff like that. Understand each other in terms of people who are translating for each other, and that's something that we really need. As you heard the stories that she shared with you guys, we need to stand as a whole to make sure that we are heard in terms of our translation, like she said, and we can only achieve something if we stand together and we fight for what we want. We need to stand together with the people who are helping us in our communities, and it's not they're not asking you to pay anything out of your pockets. Just attend the meetings, stand with whoever is there to help us, and give them a helping hand, so we can win and we can see exactly what we need. She says that in order for us to get what we want and the resources that we need in this community, we need to stand together. Everybody needs to come out of their house, their comfort zone, come out, stand out. Let us know, let us hear you guys and what you guys need, or else you guys will always have this health problem, and not only just health, in any other areas that we need help in. We have a lot of struggles in terms of the language, the culture, and the only way for us to beat those struggles is if we stand together and we fight for whatever we need. Especially the mothers, because the mothers they build the household. So we need the mothers, we need the teenagers, we need anybody that we need to come support us and help us fight for what we need and what we deserve. Our problems don't end here, but we're going to end it today over here, and we thank you guys for coming. And I hope you guys do take something from this and come out and, do something for the community, for yourself, for your kids, for the person next to you. Thank you. Assalamu alaikum.
Well, I don't think anybody could have said it better. But what I can tell you is I've lived in this country my whole life. We are too wealthy a nation to have anybody in this country go without health care. And when the women finished the study, their conclusions were simple. Language is the key. Without quality interpretation, there is no health care. And that the clinics need to become more culturally sensitive to the communities that they're serving. So, to follow up what Sarah Nora said, there are ways that you can. If we raise our voices, we can change this. There are a number of things you can do. Number one, circulating our petitions, calling for the state to ensure that everyone gets quality in-person interpretation when they get to the doctor's office. So make sure you see and sign those petitions. There's also the Access to Healthcare Momentum team that has sponsored this event, and their next meeting is on Friday, November 30th at 5 o'clock at the Wellness Center down on Reitman Avenue near Albertsons. And the more people we have, as Sarah Nora said, the further we can get. So people need to sign the petition, and they need to join the Access to Healthcare Momentum team. And I want to thank the panel for the work they did and their presentations.